Sure. My question is directed to Dr. Dill. Maybe some other folks doing kind of community level work. What's the analysis or experience with public health departments as it relates to some of the surveillance issues and the partner follow-up that I've been hearing about, particularly in the South, as being particular barriers because people experience that in the same way that they experience the local police departments, quite frankly. And there's not been a lot of discussion about the way people see public health and the surveillance piece in ways that are really exactly the way that they experience the local police department. So if folks could respond to that. Thank you.
That's a great question. Panel, you guys want to take some stab at a few of the questions, comments real quick, and then we'll go on to Marshall's comment.
I'd take a stab at the gentleman who talked about the role of heterosexual men in the epidemic. And I wish we had the slides up in the sense, I think two people showed the slide that showed where the rates of HIV are, and it was African American men who have sex with men, and then you saw them go up, and right next to African American heterosexual women was African American heterosexual men. And I think it just brings us back to, we have to stop singling out special groups to pay attention to. You really do have an epidemic that impacts a large number of people, and we have to approach it in such a way. We can't play our special groups off of each other, either in terms of the attention that's paid to prevention or attention that's paid to how we manage the epidemic, or the money that gets associated with it. It can't be an either or. We've got to look at programs and approaches that addresses groups that are impacted by HIV. And we can't look at only one group and think that, well, the money has to come from there to there. We've got to make the pie big enough that we can take care of everybody. And if we play people off of each other, we're going to look up, as I said, 5 years, 10 years from now, and have a whole other group that have grown up into a large epidemic that we didn't pay attention to because we were paying attention to something else.
And I like to just say, again, at a community level, where heterosexual men fit is right at the table to be a part of these same discussions, talking about what it is we must do in our community, because the same support that we were focusing on with respect to women, making sure that men are also going to those centers, getting tested along with the women, having the conversations, talking about sex, and how this is impacting our community. So I say you belong right at that table as a part of this discussion.
I'll just make one other comment on that too, that the most effective voices to help us stop violence against women by men are other men. Mm-hmm. Men listen to men, and it's men standing up and saying this isn't acceptable that is very powerful.
What about that health department question?
I think I'm in absolute agreement. I just think that there's a base level that our straight brothers have to get with first. And that is that particular issue. And it's not just violence against women. It is not treating women equally, period. Whether it's in sexual decision-making, whether it's in any decision-making, that's still, we want to talk about all the feminism and equal access and all of that for women in this country, and that's not necessarily the case. Some of the most, I heard another comment earlier today, I think it was Linda, some of the most powerful people in this room, when that bedroom door gets shut, they wimp up like the rest of us. So and I'm talking about the women, and so there's a place where straight men have to get straight with themselves about their role first. And that can't be done at the table yet, because it has to be done with each other. It has to be done within. And you're not even going to get to that question until you address the question of homophobia amongst our straight men. And I say that because that whole question of masculinity is the problem in a lot of this. And we act like masculinity is a foregone conclusion, that we know what it is, that it's already got its definitions, just like we have this assumption that we know what gender norms are for women. You've got these gender norms for men that don't serve us anymore. And that's what has to be fixed first. And the last thing I tell you is, you can do it. We can help. But you can do it. And that, because it's not, nobody else is going to show up and do it for you. Nobody showed up. Do you think anybody showed up for women? No. Women literally had to say, what we're going to do.
And I agree with my sister on most things, but I think that can be done together at that table.
Yeah. We still have this debate going on. I think that table is but you got that other table that has to be set.
I'd like to add something. From the Hispanic Latino perspective. Again, we have the same issues in our community. In fact, men are raised with all these oppressions as well, and these ideas, the masculinities ideas, and we have to deal with that as well. So it's not just an African American issue, it's also in the Hispanic Latino community, and certainly I can tell you in Puerto Rico, there's no right clinic for men's health that men can attend like women have. And so there's also issues related to health care for men that we're not dealing with. And to the extent that we generalize some of these facilities and open our doors, then we will have men as part of our clients and including them in our daily life. And certainly they're part of the discussion, certainly.
We're going to have to close out. Linda.